What is a mangled extremity? A terminology not quite known by all, is it? So put to some light on it, it is nothing but a limb with an injury to at least 3 out of 4 systems, including soft tissues, bones, nerves, and even the vessels. Now, mangled extremities have historically been associated with very high amputation rates. The postoperative complication rate in mangled extremities is substantially high, irrespective of the nature of the surgery that is being performed. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be discussing about the vascular endothelial growth factor as a healing marker in such cases. Researchers have attempted to identify the role of tissue vascular endothelial growth factor as a marker of neovascularization in skeletal muscle post-injury and also its prognostic significance if there is any. Now, the study that I'm talking about is published in the Journal of Postgraduate Medicine, Education and Research. A pilot study including around 30 patients was conducted where the patients were divided into 2 groups based on the mangled extremity severity score, each containing around 15 patients. Group 1 patients with a score of greater than 7 were planned for amputation, whereas the Group 2 patients with a score of less than 7 were planned for limb salvage. The intraoperative, the skeletal muscle biopsies were taken in both Group 1 patients from 3 different zones. Zone A was the mangled zone, Zone C was the clinically healthy zone, and the Zone B was the intermediate one. Whereas in Group 2, muscle samples were taken pre and post their debridement procedures. All the skeletal muscle samples were subjected to H&E staining followed by IHC examination in an attempt to identify the viable muscle in various areas of the limb. It was hence found that in Group 1 patients, the percentage of viable muscle fibers increased from 6.7 to 73% from Zone A to Zone C, whereas it increased from 7 to 80% in the other group. While on IHC stained samples, the median score was 0 in all the 3 zones of Group 1, whereas in Group 2, the median IHC score was 0 and 1 in the pre and post debridement samples. So the higher immunohistochemistry scores in Zone C in Group 1 and the post-debridement samples in Group 2 both represented an increased vascular endothelial growth factor expression in these zones post the injury. So this definite increase in the vascular endothelial growth factor expression in turn did represent a higher neovascularization activity in these zones as a response of the body to repair the damage post-injury. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.